Eleanor Walker, and I'm chair of the APA COVID pandemic work groups and I'm the chair of the one on COVID IPV, which is on violence, interpersonal violence. But we've got two other of our work groups that are here with us today, which is so exciting. We have the work group on the international whole person approach, and we have the work group on the hospitals and hospital workers and addictions, and I think several other things, which they're going to tell you all of the other names of their group. But the most important thing is they're here with us to talk about the very important work that they've been doing. Today, as you know, this is our roundtable. We'll be on from 12 to 1 Eastern time. We do this every Thursday. And we will start off with several presenters who are going to help us focus on our topic for today, which is on the increase in youth suicides under the pandemic. Terrible, terrible reports that we're getting. And so we really want to see what we can do as mental health workers and people in general to try to help stop that. And so we're going to, after our two presenters today, we're then going to go into a discussion. If you are on COVID IPV Live, please type in your questions. If you're watching this as a video afterwards, type in your questions anyhow. We go back and we look at all of them so that we can try to respond to people. So I'm going to just let you know who I can see. Some people are on and I can't see them because we have about 15 people on already. But I'm going to tell you a couple because we're international, and I think it's so exciting that we have Dr. Marilyn Safer, who's here from Haifa, Israel. We have Dr. Eleanor Pardes, who's here from the Tel Aviv area in Israel. I always forget which town it is. We have Janet Plotkin-Bornstein, who's here from the Hospital Workers Group. We have, and I'm telling you just in the order that I see people, we have Dr. Eileen Serlin, who's the chair of the International Whole Person Group from San Francisco. We have Robert Ross. I'm not quite sure where you're from, but I'm sure you'll introduce yourself later as well. We have Dr. Maureen O'Reilly Landry, who's here from New York, and she's also part of the Hospital Workers Group. I think it's New York, Maureen. We have Dr. Giselle Gaviria, who you met, who introduced us and started us off. She's here from Fort Lauderdale, Florida, like I am as well. And we have Brittany Geddes, who's here from Pennsylvania. So these are the people I can see. I know, as I said, there are others who are on as well. So let me introduce our two speakers right now who are going to help set the stage for us this morning. We're so excited to have both of them. One of them is Dr. Patricia Villavicencio Carrillo. She's here from Madrid, Spain. And she's going to talk about some of what's going on at the hospital and her practice in Spain. And we have Dr. Patricia O'Gorman, who is going to start off our presentation. She's here working with the Hospital Workers Group as well. So with that, Dr. O'Gorman, I'm going to turn the stage over to you and let you go ahead.
Thank you. Thank you. It's a great honor and a pleasure to be here and to share my concern and our growing concern about what's happening with addiction and the interface between addiction, child abuse, domestic violence, and teen suicide. I have been working in the addiction field for quite a while, from administrative positions to working in the United States, what's considered child welfare, and now consulting in 2 different addiction programs. 10 days ago, I was doing a psych evaluation, which I normally do with children who are entering inpatient addiction treatment, which means their addiction is significant enough they need this level of care, highest level of care possible. And I was speaking to a 12-year-old boy who told me in very, very clear terms about his suicide attempt. And at first, he didn't even look pubescent. So I remember asking him again about this. He said, no, it wasn't an overdose. I wanted to kill myself. And he said, Miss, I've been taking, pot since I'm 6. I take LSD, I take some pills. I knew that wasn't going to do it. So he took a whole bottle of Tylenol. I have been seeing since the pandemic an increasing number of children, young children as young as 12, sometimes, late teens. When I ask them about their overdoses are intentional. These are not accidental overdoses. In fact, yesterday in a program, I work with veterans. Many of them are young veterans, they're combat veterans. And I mentioned what I was doing today. One of the veterans in one of the groups I run shared with me that his experience is that vets are beginning to have it as a badge of courage how many times they've been Narcaned. And we know with how many people have been Narcaned, there are also an increasing number of people who have died. Last year in the US, we had 81,000 people die of an opioid overdose. Plus, we had 95,000 people die of an alcohol overdose. We have outrageously high numbers with addiction in our country. And I wanted to just share with you some highlights of some things we can do with kids to actually make a difference. I spent, as I shared, the last 10 days really going over the information about just assessing risk levels for teens. And the latest study I read was one this morning being released in Detroit on risk factors. We need to consider variables that are other than traditional mental health variables in this. We need to look at access to drugs and alcohol. We need to look at use of drugs and alcohol. We need to take a look in the parents' medicine cabinet and see what's in there. We can't assume because a kid says, I'm not taking drugs, they don't have access to drugs. Tuesday, I evaluated a young man and who also intentionally overdosed. These are also children with severe child abuse, and I'll get that in a moment, to that in a moment. And I asked him about what he chose to overdose on. And he said he went to a reliable source and he said, I don't usually do painkillers, but I got enough painkillers that I knew it would kill me. And he said, I'm happy that I called my girlfriend to say goodbye because she told her mother and they ran over and Narcaned me. This is the life of our kids. I mean, it feels unbelievable. The whole pandemic feels unreal, but how kids are intentionally killing themselves is another level of unreality we have to take carefully. So we need to speak to kids about drugs. We need to ask them. Kids, as part of mental health assessments, need to have drug assessments. We need to look at access. All kids have access. So if a kid is depressed, please consider them at risk for suicide. Also, what I found interesting, which was new information for me as a psychologist, is that the research is showing that 25% of the people who commit suicide do it within 5 minutes of thinking about suicide. That suicide is now being considered as very impulsive. The research also shows that if someone has been drinking even a little, they're more likely, if they have a thought of suicide, of acting on it. We need to put together these different bodies of literature, if you will, into a whole so we can assess our children and protect them. And of course, at high risk, which is not in any of the assessments I've seen, are kids who are being abused. And the kids I happen to see, it's now been 3 in the last 10 days, severe sexual abuse, severe, ongoing since they were very young, one since he was a toddler. So that's, again, higher risk. We need to do a much better job about pulling together and being clear and asking the hard questions, asking about drugs, asking about sexual abuse of children, even of parents. We can't be polite and quiet And these assessments I've been reading, I would describe as polite and quiet. They're designed not to upset the adults. We need to get the adults on board in recognizing what's going on with kids so that we can stop this, because as we know, this pandemic is going to continue. It's not going to be magically evaporated. Our kids are under high distress. Many of them are locked up with abusers that they can't get away from. Many of our systems are collapsing, and our child protective services is one of them. So we as psychologists can help by helping people ask questions that they're not asking because they're not on the standardized protocols. So I think that is my 10 minutes. Lenore, is that my, so I don't want to go over, so thank you.
No, you have about 3 more minutes.
I have about 3 more minutes. Okay.
Yes, I'm fascinated. I want you to continue.
Oh, thank you. Thank you. So therefore, so let's ask the hard questions. Are they in a family where there are parents who are using drugs? Many of the kids I see get their drugs from their parents who are using drugs. Then there are parents who are prescribed drugs. We know about the opioid epidemic. We know in the United States, I think just this morning, there was almost a $500 million settlement with a PR firm that was publicizing opioids as a wonderful treatment because, no side effects. We know it's out there. We need to literally lace together. If any of you crochet these different pieces together and begin helping people ask hard questions, and doing that in a way that respects parents. Parents who have addiction are parents who love their kids. They're just sick. Now, if they had cancer and open sores, we wouldn't say you're a bad mother because you're oozing on your baby. We would say, oh my God, you need help. Well, people with addiction are oozing inside. They need help. And by not addressing this, we are putting at risk a whole generation of kids. High risk. And then there are all the other kids who are at risk due to the pandemic, but these are the high risk kids who are really literally dying in front of us. And we can't Narcan them all. We can't do that because we don't have access to them all. So for me, in a situation where I do psych evals on kids coming into an inpatient facility in 10 days to see 3 kids, we're also having police come in. The sexual abuse is so bad, we're having police come in and doing investigations at the facility. This is not a typical drug facility that you have this stuff going on. This is not normal. Everything is very hyped up because of what's happening in the pandemic. So crisis is opportunity. Let's surface issues, the intersection of addiction, child abuse, drug availability, and mental health issues, and put it together in something that we can all talk about, train about, get people realizing they can do this, they can ask the hard questions, and we can maybe save some kids. So thank you.
Thank you so much, Patricia. That's really important information. I'm going to turn now to the other Patricia. We have 2 Patricias today. Isn't that fun? And this is Dr. Villavicencio from Madrid, who I think is going to tell us about some of the programs that they are working on in Madrid as well, because children all over the world who are not in school, so many of them, as you said, Dr. O'Gorman, nobody's seeing them unless they get to that desperate point that they get to the hospital. And so I can't wait for us to get into discussion. Dr. Villavicencio, take it away.
Thank you so much. It's such a great honor to be presenting with you, Patricia O'Gorman. I love what you said. I'm an expert in trauma, basically in battered women, since I started my PhD and met Lenore during those times, remember. But I work in a mental health unit for child and teenage mental health unit in Madrid since 6 or 7 years ago. And it's very hard work since before COVID. Before COVID, I focused especially on kids starting 11 up until 18 years old. And my office was full of suicidal kids, teenager, before COVID times. And because of that, I did I opened a couple of groups just for follow-up because I'll be sharing with you right now how is our public health system, so you'll understand what I'm talking about. And let me see. And so I was really concerned about mental health and suicidal kids. And what I do is regarding assessment, I always apply a couple of questionnaires at CDI for depression and for kids. And item 9 it talks about suicidal ideation, and Beck's depression also. Item 9 talks about suicidal ideation, and which is very interesting. If you don't ask directly to the kid about this, they will never tell you, never, not even you. They're coming for anxiety problems. But if I do this as a protocol, I apply this and go right to item number 9 and say, I will not kill myself. I'm thinking about killing myself, but I will not do it. And when you ask the kids, why you wouldn't do it? When they say to you, because I don't have the courage, that scares you, because they'll find the courage someday. Okay, so I'll tell you, wait a minute, let me check. I want to share a couple of things. Okay, I'm a doctor in health psychology, and I work in a public hospital, which is Hospital Clínico San Carlos. I'm also an associate professor at the university, so I have students from masters in my office regularly, and I have questions I would like to share with you, and maybe some of you will answer or give me some ideas. That will be, what's the impact of COVID-19 pandemic on lockdown on adolescent mental health and development? Could social isolation, stress, and adversities that were installed and are installed right now during pandemic result in poorer relational experiences and affect the brain's underdevelopment? And could this, I'm sorry, cannot, how can I, and how do we best work on, do something about teens and youth mental health during this, the largest public health pandemic of our times? And this is regarding not only mental health professionals. I'm talking to teachers. One of my goals in working with teenagers is working with their parents, but also we have coordination, what we call coordination with schools, and we have once a month a coordination day. So I have personal interviews with teachers and psychologists. And what I try to do with these kids that are suicidal is, now that the COVID lockdown and all the measures have stopped me doing the groups, weekly groups, that worries me a lot. That's why I was very interested that we could talk about this, because now kids are, not all of them are going to school. Some places in the world, they're staying at home under lots of risk. Maybe they never had been maltreated, but now parents under such great distress, unemployment, and so mental health issues, parents' mental health issues, kids' depression doesn't look like adults' depression. Remember, kids, teens don't cry, you don't expect, they maybe are having this irritation, they're answering you badly or misbehaving. That's maybe it's a bit depression. So don't expect people there and teachers and parents to have your kids crying around you, and they, please think about what's going on right now, especially during this pandemic, regarding schooling. And I asked this is a picture of our unit, and let me check the time. And so, and for example, Alfonso Ladron, who is a clinical psychologist, a specialist on autism syndrome, he says, now that we are going through the world of isolation, confinement, and communication difficulties, these situations worsens on those where these kids these problems are there in their core base. And there are many measures that regarding autism kids, given them the possibility to leave their houses. There's a whole issue regarding this. I'm not going to talk about this now. And Rosario Perez, who is a psychiatrist, gave me one example what's going on in our emergency room at the hospital. In the November 25th, an exceptional situation happened. 4 adolescents patients at the psychiatry emergency unit. 2 of them had suicidal ideation, and the other 2 had taken a drug overdose. No admission beds available at any child psychiatry units in Madrid, and we have many hospitals, lots, 6, 7, and the room for no room for these patients. Not even for the observation room had been assigned for COVID-19. And so for this reason, 2 of them, aged 16 and 17, were admitted at the adult inpatient unit, and after informing minors prosecutor's office. And Virginia, one of Virginia and Belen, interns, one of psychiatry and psychology residents, if a teen or young person had made a suicide attempt, try to talk about suicide openly. Don't avoid it. Try not to preach or be judgmental. So that's one thing. And Clara, finally, Clara is one clinical psychologist. Suicide can be seen as a permanent solution to intense pain. But although it may not seem like it, hopelessness, pain, and emptiness are temporary states, and they are not permanent. So that's one thing that I want to add to Clara's note. It's we need to be really having hope for our own lives in order to give the kids hope. So it's so important to have supervision during this pandemic for all of us. This has been a great thing for us, Lenore, that you have given us every week for roundtables, and also for our group in hospitals and rescues workers. This give us hope and support for our mental health, so we can give hope to these kids. And I'm not going other notes for my colleagues. And Spain national health system, it's based on the principles of universality, free access, equality, fairness, and financing. And it's free, it's funded by taxes. And our mental health care is in the social national system is provided through primary health care, outpatient specialized settings where I work, and we have specific units for child and adolescents, hospital beds for acute episodes, and it benefits for diagnosis, follow-up, mental disorders, psychopharmacotherapy, individual, group, and family psychotherapy. And it's true that, here I put some numbers that you can check later. And children and teenagers and young adults are greatly impacted. We also are impacted, but we are grown-ups over that age. Abrupt withdrawal from school, social life, and outdoor activities. Please, we need to be compassionate with young people. I've heard in the radio so much criticism about how young kids or younger adults are misbehaving. Please, we need to understand them. And of course, we have to make them realize that we're going through this terrible pandemic and that all of us are at risk. But we as young kids never had been through this. So please don't criticize them so much. Be compassionate. And they are having so much hope, lost their hope. And we need to give them hope. And school life and outdoor activities. Some of them have experienced, as you said, Patricia, domestic violence, abuse, an increase of abuse, and they are locked down with their abusers. Stress created by all the events and so on, behavioral problems, anxiety, depression, and PTSD. And this is the suicide risk protocol, and I will be ending now because I think it's about 10 minutes already, Lenore. So last decade was a huge problem for us all over the world regarding how the numbers had increased and our attention on suicide. It's been the second leading cause of death among teens and an increase in young suicide prevention efforts. Each of us have been working on this, especially people, professionals working with younger people. And the protocol against suicide here in the Comunidad de Madrid, Spain has been divided in 17 communities, and we have 2 autonomous cities in the northern part of Africa. And we have an R-Suite program. If any kid that has tried to commit suicide or it's at risk of suicide, has a guaranteed preferential care for suicidal suicidal patients, and it's called Arswick. And last week, and I will finish in, had this young girl that had been released from inpatient unit after trying to kill herself. And she came with her mother, and fortunately I had an hour and a half, and so I could do a long, thorough assessment and crisis intervention. And she ended up having also at the same time, fortunately, and usually we have this, her psychiatrist the same day. So after talking to me, we talked long, and then I assessed if she had still in mind, killing herself. And she had this in mind. So they had released her because she acted as she was okay. And she learned how to show this. And she shared this information with me. Fortunately, she did not fake it with me. So how did you manage to get released? And she explained me, well, I smiled and said this and so on. But how do you feel now that your mother will be working and you'll be home alone, or going one day, and do you think you'll be okay and you won't be at risk? And she said, oh, I'm not sure. I did not share this at the end of when they released me, because I had made up my mind to share my real thoughts the last day I was at the hospital. So this girl, fortunately, had another appointment with Rosie Perez, the one who gave me the note, and she prepared an inpatient intake for the coming days. So we talked to the mother, and so this is something that we have to have in mind, because our health system all over the world is overloaded with COVID cases, and which every department is sharing beds, right, with the rest of the most critical and risk COVID patients. But what about these kids? What about the rest of mental health problems arriving to the hospitals? We need to do this, something about this. We need to stop this mental health pandemic and do something now that we can do regarding the near future. They're our future generation, the future of the planet. We need to do something about this. And
I love your passion, Patricia. Let's see if we have some ideas. If you can stop the screen sharing so we can see everybody.
all right.
It's wonderful to see. I mean, it's sad, but it's also wonderful to see that we are not that unusual, despite the fact that we're separated by so many oceans and miles. I know back on the chat, Dr. Safer was saying that you had some information about Israel. Did you want to kick off our discussion with some of that information?
Before that, I just wanted to mention, as many of you know, I'm addicted to reading all the different newspapers, and there's a general concern about an increase of pedophilia with children being at home and on the internet, and increased activity. And so I think that when we're talking about parents, they really have to be a bit more careful about what's going on and the games that are being played. And you've actually had in Florida a terrible incident with Um,
Yeah, we had two FBI agents who were killed
Mm.
while serving a warrant, and several others who were shot. I work with that unit, that FBI unit on child protection, and they're excellent
mm,
officers. So we're all very saddened by that. It's interesting that pedophilia is so little discussed, and I think we need a whole session on pedophilia, which Marilyn is suggesting, because it takes different forms during the pandemic, because so many of the kids are getting captured on the internet. Um, we can people can unmute themselves if you
Yes.
want now.
I have a question in regards to what have been some of the experiences for safety planning during COVID, especially safety planning during this.
I couldn't hear what you were saying. Sorry.
One of the questions posed online said, can you share some more of your experiences on using safety plans during COVID? Is there anything that has changed during this process or that you're adding and implementing a little bit more?
The safety plans I do are with kids, and they're very body focused. And I help kids tune into the warning signs that are in their bodies, not in their heads, but in their bodies, that let them know they're going to then act. These plans are shared with parents, but I want to take a moment to just get back to your real concerns here about parents. Parents are so overwhelmed, they don't know what to do. And just one piece of the kid I saw Tuesday is we just reported this, he was recently, before he came to the center, he had met somebody online, the person stalked him and raped him. You know, right from what you were saying, Marilyn, it's happening. And by and large, the children who come to this center are rural. They're not all rural, but this is rural America. This is not urban, some urban kids, but mostly rural. And parents are totally overwhelmed. They're in their beds. They're drinking more than they've ever drank before, even if they're not taking drugs. And I don't have solutions to everything, but I think we can begin to articulate what the problems are. And that one of them is, internet surveillance of some sort, which we need more of. Another is really figuring out how to support parents in their very reduced circumstances. I'm reminded that recently that Jehovah Witnesses in my community, as many, would come knock on the door. Well, they just sent a letter to me because they're not knocking on the door. But maybe we need something like that, some sort of community outreach, which we've started in our rural community, just knocking on people's doors and saying hello. I baked cookies and brought them to people because I don't know if they're okay, if they're alive behind their house, their door, because I haven't seen them for weeks, maybe. And I'm reminded as I'm talking that I grew up in New York City. I grew up in an apartment building. Everyone took care of everybody's kids. We were very, connected. I'd be yelled at by lots of different parents, not just my own. So, maybe part of what we need to do as a society is to figure out how to connect with our neighbors so they're not so isolated. And yes, you have a mask on, and yes, all these things, but there's, we have so little human contact. And with children, by the way, and just one point Patricia made about, there is something for abused children that's called chronic suicidal ideation. It's very common for kids who've been abused for a long time. I just want to put a plug in that we really need in DSM a diagnosis for trauma in children, and it doesn't look like PTSD because it's not event specific. It is the chronic erosion of the relationship and the blaming of self. It's a very different dynamic. and we really need to have that, and we don't. So it's really hard to even diagnose the kind of trauma I'm seeing because it doesn't meet criteria. So, I mean, that's another thing we as psychologists could do. We could be better about developing screening. We could really push to have better diagnoses for kids who are so traumatized, you know, within home and care settings.
We're trying to work on, I'm chairing the APA task force on guidelines for professional guidelines for working with trauma. And one of the things we're very clear about is PTSD is only one form of trauma.
Right.
It's most commonly talked about, but trauma is seen in many different ways, certainly. And we have to be, we as professionals have to really be more aware of it. We don't do a very good job of training people in trauma identification in graduate school. Something that we need to do more of.
Yeah.
I see, Janet, you have your hand.
Yeah, hi. You know, both Patricia and Patricia know that I've said this to them before, that they do the saints work, the angels work. I mean, I love both of them, and the work that they do is so important. You know, one thing that I mean, really beyond words, and I think about just all the levels of intervention that need to happen, both, you know, kind of the root causes in terms of all of the systemic issues that exist in our society to the more micro issues. But one of the things that I think about, and I love all the ideas that both of you have suggested, I always think about a sense of community connection. You use the word connection, Patricia. A sense of community being an antidote to that internal suffering, that internal shame, all of that angst, right, and the isolation. And so I wonder about, what kinds of healthy internet communities can be built amongst teens to support and to counter that sense of isolation and pervasive, just all the psychological sequelae of everything you're talking about. You know, and so that's what I think about at kind of a more intermediary level, how to build those communities and that support. And within that, I think about the different demographics of teens that are affected, the LGBTQ youth, and I think about their communities, Black and Latin and communities of color and their communities, and what might be reparative there. So, but thank you.
I know with I'm on the.
I want to let somebody else
Okay.
jump in if for some ideas, because we're going to run out of time very quickly here. I don't know if anybody else has hands are. Hector, did you have something you wanted to share?
Yeah, on the same.
And introduce yourself.
Yes, how you doing? I'm Hector Biaggi. I'm the medical director here at St. Joe's. I work with Patricia and Robert Ross. And then the last speaker, I believe Janet, mentioned something that I'm also interested in. And that is what type of services we can provide the kids at a community level. Like you said, you know, isolation leads to acting out. You know, there is a saying that my brother-in-law, who has been 27 years old, you know, in sobriety, usually asks me, is, Hector, what is it that you need to remember every day? And then, you know, I repeat to him, yeah, I know, Hector. He happens to have my same name. And then I tell him, boredom is the devil's playground. Now, having you know, the opportunity to have psychologists from Madrid, you know, I would like to know, Patricia, what type of outpatient programs for the youth you have in Madrid. A couple of years ago, I had the opportunity to do a Camino in you know, in Galicia, and then one of the persons there told me that they don't have that much juvenile delinquency, and they don't have that many gangs in the north part of the country. And one of the things that he was saying is that there's a lot of community involvement. So I want, excuse me, I want to know how, what type of programs you have in Madrid, preventive in nature, community-based.
Patricia, if you could please unmute yourself.
Well, nice question, Hector. Community-based, not mental health, you mean, or that will be at the level of prevention?
Yep, both for mental health and or substance abuse.
Oh, you said.
I want to know if there are any youth centers.
Yeah, there are many. We have many. We have school and school interventions and prevention programs that I think it's all over that have no way to be on right now. Since this preparation of this presentation, I call my kids high school, and I offer myself as a professional working on teenager. That's one thing that we could start doing. Offer our services. It's true that we need money, but we also need kids' mental health improvement. So I talked to the school and said, listen, I can help give anything that you need. So my kids' school, they usually have conferences, parents gatherings, and so on. In our mental health unit, we have started under the guidance and leadership of our coordinators, who is a psychiatrist and psychotherapist, Nuria Tur. She's an expert on mentalization, and we have started a program just before COVID for kids, teenagers with suicidal risk. And we have this, we call it terapia ambulatoria intensiva, intensive ambulatory, I will say ambulatory, intensive therapy. And it's a program protocolized under mentalization. It's Bateman and Fonage's program, and that's one thing that we are doing. And of course, we need more clinical psychologists in our mental health. That's one thing that we do need, especially now during the pandemic. And for the kids, I think we are getting started to have a stronger, in Madrid, a stronger input in resources in mental health, youth mental health. Still, we are in the not the beginning level, it's second level.
In our clinics here at Nova Southeastern University, we actually have had preventive drug groups. We worked very closely with the schools and with the police to be able to send us the children, and we have a clinic that really runs groups for these children with Dr. Van Hasselt, who runs those groups. Unfortunately, we don't have the ability to do that. We have teenage drug courts, but they're not in session. The courthouses are closed. So we don't have the access to these children, the high-risk children at all. And, you know, there's very little way that we've been able to get access to the children when they're out of school. And I think for teenagers, not being able to go to school has been the most difficult. But every time we try to send them back into school and open up the schools, they end up having to close down again because of the pandemic. So I think we have to find ways to support that are addressed directly to the next few months or so that we're going to continue to live this way. Robert, did you have your hand up? You have to unmute.
I think I may be the only non-clinician on the screen at the moment, and I'm the CEO of the addiction treatment program that both Patricia and Dr. Biaggi work at. I guess my encouragement would be, we feel very fortunate at St. Joe's because both of them have focused us on needing to realign resources during the pandemic for kids. And we don't necessarily have more resources because of it, but it's been my good fortune and our team's good fortune to have the two of them and others pushing us to take a look at how we're using resources in a different period of time for kids who are at greater risk. So I would just encourage all of you to use your voices wherever you have them to push the people who have the ability to realign resources. We all need more, but before the more comes, I would really encourage that because it really makes a big difference. And thank you for the opportunity of listening today.
Thank you for joining with us. We have just a few more minutes, about 6 or so more minutes. So if we have somebody else who hasn't spoken yet, Eleanor, I see.
Yes, I really want to thank you for those very important messages. First of all, asking the right questions that will open doors, and that genuine listening is really, and patience is so important. And I really appreciate that. Instead of asking out of a standard list, you take a more humanistic and sort of very individualized approach. I really I think it's also very important that the passion and compassion in which you both talked about working with the parents and also seeing how overwhelmed and stressed and helpless, powerless, as you described, and coming from an attachment-based program and focus. So really, I would advocate, this is a shift from seeing the parent or the child or adolescents as the problem to seeing them, the relationships, the attachment bonds as those secure connections that we want to strengthen and help move. And I really appreciate the third point was the community approach. It reminded me of that wonderful research with the grandmothers in Zimbabwe, where grandmothers on the bench were part of this big research and prevention. So just having grandmothers, this is not COVID, but this was about 4 years ago.
No, they're actually using a lot of grandmothers in this process. There was a whole article on that. You're actually absolutely right that they're using it during this time of COVID. So wow. Yeah, Eleanor, I thought that was very interesting that they're helping actually with the support of PTSD. They're using grandmothers in regards to more community ingrained effort during this time.
Wow, amazing. Thank you so much.
And then I just wanted to add a little bit of a plug. So COVID IPV group on Facebook is almost up to 250 new members. 250 members. So please tell everybody, as well as for, we need more members for the international whole person approach. We'll get more of these videos, more speakers. We also have Instagram at COVID IPV. I know that some of us have been attempting to handle some of the LinkedIn as well. We're on Twitter. The more information, the merrier, as well as suggestions of any type of topics that needs to be discussed, especially during this time. private message me. I had a couple of people messaging in regards to certain questions that were being answered at this. So just my plug, please keep sharing the information for a lot of newcomers in the profession, mental health, social work. I've had a lot of individuals in social work, mental health counselors also approaching and seeing and viewing our, as well as people from Colombia and all over the world, how we've been seeing it. So please keep joining, keep sharing.
Eileen, did you want to say something before we have to end?
I would like to let Carmen Valiente after Eileen a couple of words. Menchu, please, after Eileen.
Okay.
Quickly, again, I want to thank you all. This is so timely, really, really, really important for all these reasons. Just to add an example and to follow up on Dr. Pardes's notion about a holistic approach. I was last night I do some supervision with psychologists in China, and the issue came up of it was an 8-year-old boy. They didn't know about concepts of the identified patient, for example. They really thought the kid was the problem. The parents brought the kid was acting out, and all the blame was on this child. And the psychologist there hadn't been trained really to look at the whole system, and that this child was not the problem or the patient. So just really look at, we talked about the family, the community, the school system, really everybody in the system is contributing. So we're really, really worthwhile. And then to echo Giselle, Dr. Gaveria's call, our committee is whole person, and we really do look at that. We're international. We have our Facebook link also. So please join us. We all need this information, and to pool all our resources at a time like this and approach. So
Absolutely.
I think it's so important for all of us to really be able to share with some of the newer things that we have to do to get back to some of the older programs once COVID leaves our air. But at this point, we do need all of us to reach out to young people. I know as a grandmother, I call my grandkids much more frequently, and they're ready to talk to me more frequently than they were when they were running around with all of their friends. So I think all of us who are listening as well need to reach out to young people and to the parents, because it is so stressful for all of us trying to maintain everything as we are doing. Many of us who are beginning as mental health workers who are beginning to be able to get to the vaccine, as we become safer, we can be more out in the community. Patricia, you wanted to say one word. We just have a minute or two before we want to announce next week. You're muted.
It's Carmen Valiente with us, a very close friend and colleague at the university. And thanks to her, I started working in the public system, and we were researching together during my PhD. Carmen, please, you have been working on COVID and how the COVID lockdown impact on the youth and Spanish population. Just say a couple of things, please.
I'm sorry I was late. I couldn't listen to all of your talks, so I'm sorry. I don't know what you were talking about at length. But anyway, I'm the clinical director at the university clinic. And over there, we designed a call center to help out students that were having a hard time during COVID. And that turned out pretty well. We enrolled a lot of our psychology students to volunteer. And we did a supervising team with professors and collaborators of the clinic. And that's the small thing we did. It seemed to help, but this is a never-ending crisis. So we're starting to get desperate. We need our freedom. But anyway, we have learned so many things during this COVID time. I'm pretty sure everybody agrees. We have learned to do therapy online, exams online, everything online. And we really appreciate to have our life back. But we got something out of this.
Thank you.
I'll be on time next
you,
time. So
Carmen.
sorry.
Absolutely true. Marilyn, you had one word before we end.
Fine, I just would like to remind everybody about the mothers needing a lot of support. Women have been taking even more childcare because very often the husbands are the only ones that, women have lost their jobs far more frequently than men. That's one problem. Two, in Israel, we have the highest birth rate in Western society. We have 3.2 or 3. So with the younger families, actually the middle classes are having more children, and these women have 3 and 4 young children at home. And I think that when we talk about our facilities, we have to find some ways to support the mothers and the women. That's something we haven't talked about.
Absolutely. These are great ideas for more programs. We unfortunately have to end. People have to get back to providing services. This is been a wonderful program, a wonderful addition. I hope people who haven't been on before will come back on again every Thursday from 12 to 1 Eastern time. We are here with a new topic, with presenters who have great ideas, with a discussion afterwards. And so I'll see you all next week. I hope at 12 noon Eastern time, right here. If those of you who are on Zoom, we're excited to send you the Zoom link, but you have to send us an email to ask for it. We don't publicize it. If you want to do your questioning on the Facebook Live page, go to COVID IPV, and we are looking, as you could see, Giselle was able to read several of the questions that came forward, and we will continue to do that. We monitor it as well. And we're hoping to be able to get the whole person group, but right now we know we have COVID IPV live.
And we know that it goes simultaneously in the international group, as well as COVID are simultaneously. So I'm generally looking through as well.
Excellent. So we got that link fixed up. Wonderful. We are becoming techies. With that, I want to wish you a very happy, productive, and safe week. And we'll see you all here next week on Thursday. Bye for now.
Bye.